Okay, so we're faced with a problem in education right now. We need to get our kids back to school coming up in the fall, in the next couple of months. And as a teacher, I want to address this issue. And I'm going to be a little selfish. I'll be honest, I'm being a little selfish here. As a teacher myself, as someone who's had diabetes for 40 years, type 1 diabetes, and therefore is more at risk in terms of contracting the virus. And as somebody who wants to stay alive and healthy, I want to speak a little bit about this situation in terms of whether we should go back to school. As if we're back to normal, everything's okay, the virus is not a challenge that is in the way of that. What I'd like to get to is a couple of specific facts that are kind of fundamental and I think really need to be addressed in terms of this issue. The first fact is that large gatherings cause outbreaks of the virus. Now, this isn't a speculative statement. This isn't a political statement. This is a fact that has been borne out by case after case after case after case. This is a reality. We know that this is true. This is something we have learned in the past several months about this virus. Large gatherings lead to outbreaks. Sometimes smaller, sometimes larger, but large gatherings do lead to outbreaks. And so we have, all of the COVID parties that these young people have been doing, and spreading infection. We have all of the nightclub stories of people going to nightclubs and partying, and the spread occurring as a result of those. The holiday weekends, 4th of July and Memorial Day, both had a lot of outbreaks as a result of the gatherings there. The story of the summer camp in Missouri, all of the people, I think they said 85 people ended up with the virus as a result of that. So that's the first fact. Large gatherings lead to outbreaks. The second fact. A school is a large gathering that occurs all day long, 5 days a week. So it's a repeated large gathering 5 times a week. And this ranges, from a small school, maybe 100 people or so, to a larger school in the low thousands. Thousands of people, a few thousand people in one building gathering together for several hours, 5 days a week. So that's a repeated chance 5 days a week of that large gathering causing an outbreak. And again, as we've seen over and over again, large gatherings cause outbreaks. So let's look at one case in particular, which I think works as a good analogy for the school setting. So there was a guy, and I believe this was back in March, there was a guy that went night clubbing in South Korea. He was infected, and he didn't know he was infected. And so he went to several nightclubs. And as he goes to each nightclub, he's exposing other people in the clubs to the virus, right? It was found out later they were able to trace about 75 cases to direct contact with this gentleman. And I believe they said there were about 25 other cases which were traced to indirect contact. So people who had contact with him gave it to about 25 other people. So 100 people ended up with the virus as a result of this one man who didn't know he was infected going out and going night clubbing. So compare this to a school. So in a school, you have students in a classroom. So similar to people in a nightclub, right? You've got fewer in a classroom, right? So that's less points of contact, but it's a smaller space, right? So you've got, say, somewhere between 20 and 35 students in a classroom. But in a large school, you've got lots and lots of classrooms, right? So that's thousands upon thousands of points of contact. And think about this. They're not sitting in one classroom all day long. In elementary, sometimes they are. But in middle school, junior high, and high school settings, they're not. They're not in one classroom all day long. They go to one class, then they move and go to the next class. So that they have, in my high school, they have 7 classes in their schedule. So 7 different classrooms they're going into. So that's seven different places where they're exposing or potentially being exposed to 20 to 35 other people who could potentially have the virus. And each student has their own schedule. So, in between classes, they all pile into the hallways. And so now there's all those points of contact, right? And then they go to a different class. Each classroom is a different grouping of the students, so what we're talking about there is thousands of points of contact. So just imagine one student who, like the gentleman in Korea who went night clubbing, doesn't know that they are infected with the virus, comes into the school setting, and they have 7 different classes throughout the day. That's 7 different classrooms in which they're exposing the other students and the teachers to the virus. But then there's also that in-between class hallway interaction where they're exposing those people to the virus as well. So essentially, I think it's absurd to assume that if one gentleman who's infected without knowing it goes to several nightclubs and leads to close to 100 people having the virus, how can we say that we're not going to have any students who have the virus and don't know it? And let's just say we have one student. If one person leads to 100 people from going to several nightclubs, one student in a building with a few thousand other students, a couple of hundred adult staff members, inevitably is going to lead to a widespread outbreak among the students and staff. I think a lot of people are worried, and I get it. And, we're concerned about, we want to get back to normal. Parents need to go back to work, and I know it's a little cynical to say it, but they need the babysitting, right? They need their children to be taken care of so that they can get back to work. Some parents, not all parents have that issue, but a lot of parents do. And we are concerned about our kids losing ground. I think that's the weakest argument, really. In the spring, just from my own experience, in the spring I taught my classes online. And most of my students did fine with it. I had maybe about 5 out of around 170 students who just could not access the online coursework. The rest of them had no problem with it. And the school district did provide some laptops, Chromebooks to a lot of students who didn't have internet, didn't have a computer at home to do it with. But there's also the reality that, listen, and I know this as a teacher, other teachers should know this, people in education should know this as well. When we present students with a challenging method, something that is difficult for them, if they actually put the work in, and do what they need to do, learn how to follow a new method, you know what happens? They become smarter. So actually providing online education will be good for our kids. And certainly there will be some that will be a problem for, and we could, although it will take some time to put it together, certainly it's not easy, but we could certainly provide some in-building support for students who just absolutely cannot do it at home. But from my own experience, like I said, I had about 5 out of about 170 who just could not access the work. So that's a small percentage. If we got that small percentage into the building, well, then we could definitely social distance and play some safety measures with those students. But with 3,000, that's about what my high school is, about 3,000 students. There's no way. There's no way. And yes, we can tell people who are sick to stay home. Yes, we can provide masks and face shields, and we can clean the classrooms in between classes and things like that. But we cannot account for, as in the situation with the gentleman in Korea, it was the same situation with the camp in Missouri. The infected persons did not know they were infected. And we cannot account for the ones that we don't know are infected with the virus. So my question is this: are we going to go back to school to score political points? Are we going back to school to make ourselves feel better about, the way everything's going with the virus? Are we going back to school because it's absolutely necessary? It isn't really absolutely necessary, let's be honest. And what are we willing to pay? I mean, are we willing to put my life on the line? And again, I'm going to be selfish here. I'm not. I really don't want to put my life on the line. But then let's look at it from the kids' point of view. Every student that goes into that building with a few thousand people, their life is now on the line. And then their families' lives are on the line. The families of the staff members, their lives are on the line. The health of thousands upon thousands of people is being put on the line in order for us to say, hey, everything's back to normal. But guess what? It isn't. In Texas, we have not reached our peak yet. And so we want a month from now, a little bit more than a month from now, to go back to pretending everything was back to normal. It isn't. It absolutely is not. We opened up the state when the numbers were massively lower than they are right now. So unless we have an incredibly, very rapid movement downward in the number of infections in the next month, we're going to have an outbreak that is so much more severe than the outbreak that happened as a result of the reopening of Texas a couple of months ago. The potential for this is just immense. So I think we're kind of making a bad decision here, just pretending that everything is okay and let's just go back to normal. I looked up the numbers and I saw in the United States there have been something like 3 million infections out of about 300 million American citizens. So that's about a 1% infection rate, right? So if we let's half that. Let's say that's over-reporting. Let's say it's 0.5%. So in a building with a few thousand people, if you've got a 1% infection rate, you can probably count on about, I'm doing the math, about 15 people being infected. 15 people being infected in a large gathering that lasts 7 hours, that reoccurs once 5 days a week. It's a guaranteed disaster. A guaranteed disaster. I mean, if you're betting on nobody getting infected as a result of going back to school, you're betting on a horse with a broken leg. It's just absurd.